Okay. Let's get this started. Here we go. All right. Hey guys, just waiting on. Oh wow, Lori, that was fast. Well done.
Yeah. Getting quick.
Every week, right?
What's that? Yeah, right.
Didn't get more efficient at this until we're like, it's gonna be like our second job. All right, so we'll just give people just a couple of minutes to hop on. And for those of you who are already here, we are going to be talking about the pelvic floor during pregnancy. So we're going to specifically address some function pelvic floor during pregnancy and um, some issues that might arise, any questions. We've received a couple of questions, and we'd love to hear any questions that you might have. While we're here live, we'll definitely be reading your comments. So don't hesitate to ask or send us a message. All right. So let's see. Get this all squared away. Okay. We'll eventually figure out how to stream on Facebook while we're streaming here. Eventually. All right. All right, so Laura, let's get started. So if we could just remind everyone who you are and what you do, for
Yep.
those who were not tuned in last week, who might be new additions to our audience. Go for it.
Yeah, my name's Laura Rowan. I'm an occupational therapist by background, and I specialize in pelvic health. So I'm the founder of Essential Pelvic Health. I treat women, men, and all gender diversities. My screen keeps going blank here. So if I poke my screen a couple times, I don't know why my screensaver is not working. Yeah, so, and for pregnancy, so I have, you guys can check out, these are kind of quick and dirty little little segments of information, and we really want to make sure that we spend a lot of time doing the question and answers, especially since we already have like 3 really great questions, and hopefully we'll get some good ones coming in tonight.
Mm-hmm.
But especially for the different topics, some of them I have like extra information on my website. So I have blog information that will kind of dive deeper and explain. So if anything like sets off a light bulb and you want to know more, you can always go to essentialpelvichealth.com, and then I have client resources. You can go to the blogs, there's videos, there's a bunch of free stuff. So just if you like anything, there's always more.
Awesome. That's great, Laura. Thank you. Okay, so do we want to start just talking about kind of the general role of the pelvic floor during pregnancy, how it might shift a little bit, and how a woman's experience and her relationship with her pelvic floor may change or shift during pregnancy?
Sure. Yep. So the pelvic floor, I mean, when you think about, the I actually have a picture I want to share. So when you think about the growing baby inside the uterus, it's kind of taking up that space that was once here, now is kind of taking over all the space. The pelvic floor is underneath, supporting the baby in the uterus, but also, as our bodies change, we need to adjust for that growing baby. And like I always say, the baby rearranges the furniture on us, the kind of intestines and the diaphragm and everything gets moved around. But the pelvic floor has to change too, because as our posture changes and our pelvis changes and our rib cage changes, that tension change on the pelvic floor makes the demand on it differently. So it has to accommodate. It's all about accommodating when we're pregnant. And we get questions all the time about like, well, if I had a C-section, my pelvic floor should be fine. But it's not all just about how the baby comes out, because if the baby isn't just coming out through the pelvic space, we still carried that weight and that change on our bodies and demand. So there's definitely, you can definitely expect changes in the pelvic floor, even if you didn't have a vaginal delivery. And the biggest takeaway, like this, I get a little soapbox, so I'm gonna use it. The biggest takeaway that I want to give people who are pregnant is that you don't have to wait until you deliver to have relief. If you have symptoms when you're pregnant, so often we hear people come to us afterwards like, oh, well, I told my doctor about that while I was pregnant, and they said, just wait until you deliver and I'll go away. So first of all, there's so much time before that happens, right?
Oh
So,
yeah.
you know, we want to be able to enjoy our pregnancies. You know, we want to be able to not just kind of suffer through it, enjoy that time and space. And the sooner that you are able to address an issue, if you've got pain, if you've got leakage, if whatever's going on, if you've got constipation, address it sooner than later, because it's going to make your recovery so much easier. So
Yeah.
that fourth trimester, after you deliver the baby and your body is re-establishing connection, it's going to go so much smoother and get you kind of back on track much quicker if you can address some of these things during pregnancy and not just wait. So that's
Yeah.
my
A lot of times women are told to wait just because, you know, maybe their provider doesn't necessarily know that there are resources that they can utilize during pregnancy. And I think that almost sets these women up for, like, you know, these maybe unrealistic expectations, like, oh, well, I'm having these issues now, postpartum, they'll go away. Because that's what they're being told, when in actuality, if that doesn't happen, and then they're dealing with their, you know, their postpartum body, they might be, you know, having body image issues, and then they have, you know, their pelvic floor issue on that. They're like, wow, what is wrong with me that this didn't go away? You know, so it can definitely add a little bit of insult to injury postpartum if you have that expectation of like, oh, this is just going to go away, or I can just deal with this later. Well, that may not necessarily be true. Plus, I know that from my experience in referring some of my clients out to pelvic health professionals during pregnancy, they do tend to get prioritized in some of the clinics. And like, I don't know, I assume you probably do the same thing in your private practice, but like they kind of get pushed to the head of the line because, you know, there's only so much time that something can be dealt with during pregnancy. So I've definitely had several clients who may have normally had like a 12-week waiting period to get pelvic floor PT or OT, and then it was reduced down to, you know, just like a week or two.
Yeah. If there's a waiting list, definitely you have to kind of prioritize and figure out when you're going to be able to get people in sooner than later, for sure.
Yeah, exactly. All right, awesome. So, as far as, do you want to do, let's use like a general overview. So just some certain questions, that I hear a lot, as a trainer. One of the questions is, incontinence, urge incontinence, or stress incontinence during pregnancy. So, you know, peeing, often and peeing when you're sneezing or coughing or laughing or jumping, specifically when it relates to exercise, specifically when it relates to like running, or any kind of like jumping or hit exercise. So what can women do about incontinence during pregnancy?
Okay. So during pregnancy, we have to have a little bit of allowance for some of these things, okay? Because we have extra weight sitting directly on top of our bladder. So it's going to be harder to manage. And we're like, as far as going to the bathroom more often, you're going to go to the bathroom more often, okay? So I'm not going to put you on a training schedule and say you should only be going every 2 to 3 to 4 hours.
Right.
There's going to be different demand and pressures. That being said, there are things that you can do to start being able to manage those pressures better, because you know we've got the baby kind of up in here. It's kind of pushing the diaphragm up, so that's messing with our pressure system. We have the weight pressing down on the bladder and the pelvic floor, messing with those structures. So I think we kind of touched on a little bit, trying to work on getting that nice big breath laterally, trying to preserve as much downward motion of the diaphragm and movement in the rib cage can help minimize some of that downward pressure. Making sure that you're managing your breath. So holding your breath, I mean, especially when things are so much more difficult sometimes, just to stand up or to roll over in bed or get up from lying down to sitting, making sure that you are engaging your core, because that feels different. So our lower abdominal muscles that typically go across the pelvis like this are now stretched out and down in this position. So when you engage it, it's not really pulling toward your spine. It's like a lifting. And you actually use the same cue that I do. It's like a lifting and hugging the baby to engage it. So being able to feel that and start to be mindful about engaging your core and giving that lift and support, so you don't revert to a downward pressure when you're doing something. And then breath holding, making sure that you're not holding your breath to get that stability, because that's how we stabilize, is like we'll hold our breath, and that it creates an amount of stability through that core in our back. But it's going to add too much pressure and strain on the bladder and the pelvic floor.
Right.
So just kind of going back to the posture and the breathing strategies and the core engagement to minimize the strain on the structures. For running, looking at the ground force reaction. So as we're landing, we're kind of doing this little mini series of like single leg jumps. So
right.
As we're landing, being able to minimize the force coming up from the ground. If we are leaning back, if our upper body is behind our pelvis a little bit and we're kind of running behind, this is exaggerated, but you get the idea. If our weight is back and we're doing a heavy heel strike, the ground force reaction is going to be 6 to 8 times our body weight. Just by kind of leaning forward and leaning into it, so getting that rib cage over the pelvis, okay, and getting a little bit more of a lighter forefoot strike, so a softer absorption and landing, then we can reduce it to 2 to 4 times our body weight. So just by position while we're doing different activities, like jump rope, same thing, tipping forward and getting a little bit lighter on the forefoot can just reduce the amount of stress to the systems. Pull-ups, again, we can get into more of our fitness one, yep. But again, making sure that we're not arching back and flaring our ribs up. Okay, so like finding the alignment that accesses our core better and reduces the pressures and stress.
Yeah, absolutely. And then kind of along those lines, as far as footwear during pregnancy, do you have specific recommendations for women to prevent them from doing that like really hard heel strike when they're running?
So good question. I haven't thought about it too much. For running, so footwear for different activities for sure. So for running, you want to have a little bit thicker heel, and you want to have something a little bit more shock absorbing, especially if you're going to be putting on some miles. But I don't have any specific recommendations necessarily, but just to make sure that you do have a good little bit of a heel. So because we have minimalist sneakers out there, and we don't want to be running in minimalist sneakers. Unless you're trained and prepared for that. Yeah. But more so, I think, making sure that you do have a good pair of sneakers that aren't worn, and just adjusting the foot strike and sometimes the stride. So if you have like a longer, heavier bounding stride, that can put a lot more strain, just even like on the pelvis with the inner thigh muscles are getting stretched more, but also with that landing, that heavy landing.
Yeah, that's really interesting. I mean, we definitely advocate like strength training barefoot in our video to encourage the connection of the foot and the pelvic floor, so that if we do have clients who want to continue running during pregnancy and then continue, they want to pick it up postpartum, they're able to actually train the muscles in the foot, because you're not going to naturally heel strike if your foot muscles are doing what they're supposed to do. So you're going to have that natural push off. You're not going to be slamming the heel and then rolling. So
Yeah.
yeah, strength training is like, I think, a huge piece of it, especially, from our standpoint.
Yeah. And, like you said, like having a good, strong foot strategy, will help kind of combat all that stuff. Because the more you wear a cushy, supportive footwear during your day, your feet don't have to work. So they get weak. So
Yeah. I had a whole conversation with a new client last week about the recommendations that she had been given, because she'd been given these like really expensive orthotics, and she was told to put them in all of her shoes and wear them all the time and don't be barefoot at all. And I was like, so you can understand how that would probably not train your foot muscles. And she was like, it isn't? Like, oh, it's definitely not. It's like, it's a crutch really, long term, for someone, especially someone who's in their 30s, to be having to live in orthotics all the time. And this was, previous to pregnancy, during pregnancy, and then postpartum. So she really had been completely ignoring her feet for like a long period of time.
yeah.
So
And your foot goes through so many changes during
yeah.
pregnancy anyway. So I had
Yes,
to get all
gross
my shoes.
and upsetting. Like, I used to be a 7, now I'm an 8.
Yes.
Another question that I hear a lot of times is peeing during the night, like getting up a lot to pee during the night. And now I know you said that it's normal to, obviously pee more frequently, just due to the pressure that your bladder is under. But when talking about like reasonable levels of getting up during the night, like what should be like, this is maybe like a little bit of a yellow flag. Like maybe I should talk to someone, about how often I'm having to pee during the night.
So good question. We could talk a long time about this one, but just for like a kind of a quick overview. So if we're focusing on pregnancy, it's going to be different. I mean, you're probably just going to have to go multiple times at night. And again, it's because of the physiological changes in your body and pressures. Sometimes maybe looking at position when you're sleeping could help, because if you can kind of offload, like as you roll and turn, that bladder is going to kind of shift and change positions. Mm-hmm. So maybe looking to see how you can offload the like baby in the uterus and give the bladder a little break. But there's not going to be too much that you can do. Same kind of for postpartum. So especially because we're, if you're breastfeeding, you're getting up in the middle of the night. Yep. You're even though you don't have to pee, like the whole thing is that you don't want to go pee unless you have an urge, because then the brainstem starts to kick in and it starts to try to like figure you out, and it starts to signal you get this overactive bladder cycle. However, again, during postnatal, you need to be able to set up yourself to be able to feed your baby and not be like, have a full bladder and like be in pain. So there are, during that time too, you have to have a little leeway with yourself, but having that awareness that is a thing, and making sure that you limit those, like just in case peas, or those like getting myself prepared, peas, as long as you're mindful and not overdoing it, then once your schedule starts to balance out, then you can jump back into it. It's, when we're not aware of it and we're just in this habit, and then baby's not getting up in the middle of the night, but we are because we're stuck in that cycle. Then, I mean, the good news is like our bladder learns our bad habits, we can also retrain it and reset it to just give us the urge when it's full. So like when our bladder fills up, when it gets full, the lining of that bladder stretches, mm-hmm. and that's what gives us a true urge. Okay. And then the pelvic floor communicates and gives us time to go to the bathroom. Mm-hmm. But because our brainstem kind of kicks in, if we go to the bathroom before it gets full, the brainstem says, oh, she likes to go when I'm only half full. So it sends the urge. It gives you that same sensation. So and a lot of times you're like, well, the only way I can go back to sleep is if I go pee. Right. And that just reinforces that cycle. It reinforces the brain, be like, yep, I was right. She wanted to go. So it can be challenging to reset, but you can reset it.
Oh, that's so interesting.
Yep.
I didn't know that.
Yeah.
Um, Another question that I've been hearing fairly frequently is about so because of I think the increased blood flow, um, having like a lot of pressure and possibly varicose veins
Mm.
vulva. Is there anything that women can do about that? I mean, yes, during exercise, but like kind of in life in general, because varicose veins are like can be very, very painful, especially when we're talking about in the vulva. That's very uncomfortable.
Yeah.
People ask me about that. Like, is there any way that they can cope with that during pregnancy?
Yeah. So, compression, like giving the veins support,
Mhm.
because especially, we want to protect them because if a vein gets stretched, it doesn't have that ability to contract again or retrain or to be able to pull it back. So you want to be able to, if there's any signs of varicose veins or hemorrhoids, you want to be able to give it support. So think about like a compression short, not something that's going to be like pinching you up here. It's just a nice gentle compression short, and then so it'll give a little bit of support underneath, and then you can add in like a pad or something to give it an extra lift and compression in that space. So support, you can use ice to like ease the pain. Witch hazel, all those nice
Yep.
soothing things that we get postnatal, but it can be
Yep.
good for or like for hemorrhoids, anything to like anti-inflammatory,
Okay.
um, can be nice. So yeah, and then working on your pressure management, making sure that you're not bearing down and loading downwards.
So how would someone know if they were bearing down, say for example, like during exercise or even effort in the sense of like picking up your toddler? Because I've had clients told, oh, you really shouldn't be picking up any more than like 15 pounds during pregnancy, which I feel like is like that's such an arbitrary number and
Yeah,
so weird to give that to like all the people.
and not realistic because we have kids. Yeah.
Exactly. Weighs more than 15 pounds. Like, don't pick up the toddler. Like, yeah, okay, we all know that's a joke. I was once told, oh, just have your, I can't remember why, but I was pregnant with my second. Oh, have your 2.5-year-old just climb into his car seat by himself. I was like, is this real life? Are you really asking me this? And I like tried it, and he like looked at me like, no, it's too far.
So training the core, making sure that you are able to tap into your exhale and engaging and lifting upwards in that core to be able to brace yourself and support yourself. Making sure that you're not breath holding for that stability.
Hmm.
And then, doing some strengthening around that. So getting those glutes nice and strong, doing some good squats, practicing like sequencing movements. So like even postpartum, like they say, don't exercise until 6 weeks. Well, I mean, come on, our life is exercise, after a baby. So, starting to be able to train for those things, just daily life things needs training. It needs strength and endurance. So being able to make sure that you are engaging your pelvic floor. So like for delivery prep, I always talk, people always like, how can I get strong enough for delivery? Well,
Yes.
delivery, you don't really want to be strong. You want to have endurance, but you don't want your pelvic floor to be strong. You want it to be able to open and allow for the baby to go through if you're having a vaginal delivery. But when you're thinking about being able to do your daily tasks and have strength for that, then that's when you want to be engaging and getting strength.
Yeah. I mean, I think, it's sort of like this interesting misconception that women have of like, oh, I have to like go really hard and do really, really hard, heavy lifts and like keep running and keep doing my HIIT training during pregnancy because like labor is going to be like a nightmare. And it's like, okay, well, we're kind of looking at this in the wrong way in the sense of, yes, labor is hard for the vast majority of women. Labor can be long, especially for your first, or it can be hard and fast, which can be even more challenging to recover from.
Yep.
And so, when thinking about prepping your pelvic floor and your body for that, definitely endurance. And also the fact that like sometimes we associate strength with being able to hold something for a long time, right? We kind of touched on this a little bit last week, but the concept of being able to relax the pelvic floor as well as you can engage the pelvic floor, if not better, is like of the utmost importance to be able to address during pregnancy, so that labor goes smoothly. Because if you're so used to holding your pelvic floor in this like tight, shortened position all the time, and you can't access that mechanic of being able to let it go to allow your baby to come down to the birth canal and be able to allow your baby to come out, and not have to like push, and you're pushing your pelvic floors like this, right? So you're under tension, but you're able to relax and breathe. So those are things that we address during Pregnant Fit. Is that like something that you talk about, like the mechanics of being able to like let it go?
Yeah. So when you think about active labor, the uterus itself is contracting, and the baby itself has like a little GPS type of navigation system.
Yep.
Like baby and uterus know, they have their thing, they know what they're doing. And we kind of just need to be able to open and allow for that to take place, and then add some extra pressure and assistance. But what happens often is we get into this like we almost like start pushing too soon before we go into the active labor. So that can be really challenging on the body. So we're trying to push, and the uterus and baby aren't quite there yet. And if we get into this breath holding and this like bearing down with our abs, a lot of times we end up closing off the pathway that we want to be opening. So our abdominal muscles and our pelvic floor muscles, they co-contract. So when going back to that breath, when we inhale, they lengthen and open. When we exhale, they come back in. And so when we are pushing, if we're squeezing our abs, our pelvic floor is closing. Okay, they're working together. So you want to think about opening, using that inhale to open that space, open the pelvic floor, and hold that space. And now you want to push through that open space. Okay, so it's like it's more of a coordination type of thing versus like, you know, muscling through it. And so a lot of times I'll have people practice it. Like that's how I teach people to go to the bathroom without straining. So for constipation, we don't want to be straining and bearing down. One, that's going to put a lot of pressure on our pelvic organs, and disrupt that connective tissue that we don't want to disrupt. But again, we're doing a lot of work trying to push through something that's closed. Right. Whereas if we open it first and then add the pressure, it's going to work much easier and safer.
Right. Yeah. I mean, I definitely heard, you know, and I think, you know, if you look at sort of the stereotypical like movie or TV show where a woman is giving birth and, you know, she's being shouted at by the doctors and nurses in the room to push, and she's like, you know, purple in the face, pushing hard. In actuality, she's probably doing something that's counterproductive.
Fighting against herself. Yeah.
Yeah. Like purple pushing is like something that I definitely heard. And people are, you know, I've said to so many clients, you know, actually your baby will come out if you don't push. And they're like, what do you mean? But that's literally the job of your uterus. Your uterus pushes the baby down, pushes the baby down, pushes the baby down. And yes, it can help it to speed it up a little bit if you do put that pressure on, but there has to be like a middle ground. It can't be like, anyone who's going to scream at you to push really is like misled. You know, they're just trying to speed things up, when in actuality, postpartum, that can create so many issues for you. Like that's definitely, you know, a factor in prolapsed organs, because you're pushing down, and your body's responding to that pressure you're applying to it. And then, you know, postpartum, you're like, wow, I feel like everything is falling out my vagina. It's like, well,
yeah, you want to listen to your timeline,
yes,
not somebody else's timeline.
Right.
And sometimes positions is a good one to go over. You know, using gravity, using kind of your movement of your legs to be able to open your hips and your pelvis. You know, just switching positions sometimes can be really helpful to start getting things going. So maybe just the baby needs a little bit of help getting, you know, into that space with gravity, rather than, you know, trying to force it into where it just doesn't have the angle.
And then, so why is there reasons not to kind of actively labor on your back. Can you explain the mechanics of that? Do you have your pelvis handy?
Sure. Yeah.
Because like
Okay.
this, honestly, like I take this for granted completely. I'm like, don't give birth on your back, and everyone's like, but why? Well,
So for one, my pelvis is not flexible. So the flexible pelvis really shows this much better. But so we're looking at the back of the pelvis right now. This is the sacrum and the tailbone, and then your two kind of sides of the pelvis. Okay. And so this, even like as we're developing, these kind of have a little bit of flexibility because we have our SI joints here and they have a little bit of flexibility. And then we have our pubic symphysis joint here that has a little bit more flexibility. And so these two bones, so the pelvis, again, it's not one closed ring. It's two bones on the side and then the spine and then three joints. So these two bones here on the side, they can kind of spread open and allow for the baby to come down, and the sacrum can kind of be like a little slide here. Okay. So if we put someone on their back, we are compressing this sacrum and we are not allowing it to move back and out of the way for the baby to come down through it. Okay. So we're kind of closing off some of that accommodation that the body is looking to do to be able to open up. The other thing that we can run into is, see, this tailbone kind of hooks up a little bit. Okay. And if we're on a firm surface that is not allowing it to move back and away,
yep.
It can get dinged as the baby comes down. So you can get this kind of like quick shearing under the tailbone, and it can be really, really, really painful. And it can take a long time for it to heal.
Yep.
And you don't have any gravity helping you. So baby's kind of in this position hanging out. There's nothing really, I mean, we've got natural gravity. We have to be careful. Sometimes gravity can be a little too much and the baby can come out really fast, like you said, and you can get a little bit more trauma to the tissues if it's too fast. Or if you have like a history of like a severe tear before, or just any sort of connective tissue issues, then you want, like, going on your side is a great option.
Yes.
But there's, making sure that you know all the different options, making sure that you practice them ahead of time. So you kind of get your hips open and flexible and ready for that. And making sure that you talk to your birthing person about it, because they might not be on board, and you want to know that sooner than later.
Yeah.
Or they may just need that prep to be, okay, well, this is her birthing plan. She wants X, Y, and Z. Just know your options. There's pools, the shower, sitting backwards on a toilet. I mean,
yeah,
there's all different options.
There are so many options, and it's funny because I mean, there are definitely certain birthing environments, so like hospitals or birthing centers, that will and won't allow for certain conditions when you're birthing. I know that when I was in labor for my third, they were totally fine with me laboring in like a bath that we had in the room, but they didn't want me to give birth in the bath. So, and it was hospital insurance reasons. So it's definitely good to ask these questions where, we're hoping for a home birth this time. And, so fourth time around, it's like, whatever, I'll just do it here. But yeah, so you have all the options. But what I found really helpful during my pregnancy was I took a birth refresher course when I was pregnant with my third with the Albany Family Life Center. And they go over birthing positions, and they actually talk about all of the positions that you can do. You can do them when you're by yourself or you're supported with your partner, whether that be, like your actual like partner or a doula. So whoever is going to be supporting you. And so I found that really helpful, because it was like, oh, we actually have to practice. And it was like, we kind of giggle through it. Oh, ha, ha, ha. But like, it actually is helpful when you're in the moment. You're like, okay, where do I feel comfortable? Because you don't necessarily know what's going to work for you. You don't know if you're going to hate the water. You don't know if you're going to like to squat. You don't know if you're going to want to be on your hands and knees. You have no idea until you're in the moment. So having options and being able to be in those positions through being strong is also, a big factor. In birth.
Yeah, and you mentioned like midwives, doulas. Like, I wish I had known about those wonderful birth workers. You know, find people to support yourself and to advocate for you, and you know, just make the whole process smoother and supported.
Yeah. Definitely. Now there's two more questions I was thinking about. So pubic symphysis pain. So like that pelvic bone, the pubic bone pain right at the front of the pelvis. Super common during pregnancy. I know that like especially for my first 3 pregnancies, wicked pain. And I had plenty of clients who also experienced that. What is your advice to the women who experience that pain on a regular basis?
Okay. So just a quick, so if you, again, going back to the 2 bones, this one bone and this other bone, the ilium. So we've got this connective piece right here, and this can get separated. It can separate this way. It can get sheared and slid. So these bones can move in all different directions and have different tensions. So there can be different reasons that could be causing this pain. But one, so thinking about like, so I feel like I need more space here. So your adductor muscles, the inner thigh muscles, come up and attach here.
Mm-hmm.
So looking at your adductor muscles and seeing if they're super tight, or if you're relying on them for stability during movements, trying to see if maybe we can do a little bit of a modification and get some work done, maybe in your glutes, or just kind of troubleshooting.
Mm-hmm.
But trying to reduce the tension of the adductors. So, you know, if you're like getting in and out of the car, like avoiding these big, like open leg kind of motions, can be helpful. A support could be helpful. So they have SI joint belts that sit lower. So if you find your front hip bones, it kind of comes below into this space and gives support for compression that way.
Mm-hmm.
That can be a good tool. But really, you know, going back to engaging that core, engaging your TA, making sure that you're involving that, you're not bearing down, can be really helpful.
Right.
And you know, going through the breathing strategies again.
Yeah.
How
Yeah.
about you? Were there certain things that you found really helpful?
Yeah. Like, so I think depending on how you carry, because like I always carry like way out front. And I had many clients who also carried like that, and it felt like they had pubic bone pain like very quickly during pregnancy. And I think even just using one of those like belly bands, like I use the Bay Obey belly band, and they literally call it like the belly sports bra. And it's literally just like spandex, and you just put it on over your belly, and it just helps to kind of pull your belly closer to your spine so that that frontward force, that like front loaded force on your body is not quite as severe as it could be.
Yeah.
So it's
And
basically,
sometimes, oh, go ahead. What was that?
it's just like acting as your core. It's just like another,
Yes. Yep. It's like another brace. So
yep.
get the low brace, I can kind of compress the pelvis a little bit together, but then you're talking a little bit more of like higher up.
Right.
So we're going to get this kind of lift and
Mm-hmm.
support as well. Shoot, I was going to say something. I forgot it.
That's right. We can come back to that.
Oh, so getting on hands and knees can be really nice too. So offloading, so getting, you know, redirecting from that kind of constant downward pressure into space, getting on hands and knees can just be a really nice relief for that. And even practicing the core on hands and knees is a great way to offload the pressure in the back and down, and to lift the core against gravity. So now, you know, we're lifting against gravity here, but now we're kind of completely changing the angle and we're lifting up in this way too. So
yeah, so like even like hands and knees breathing and like really focusing on as you exhale, pulling your baby toward your spine. Is that like kind of like that would be a good option?
yes, yep, exactly. And then looking at, you know, when you do that, do you shift back? Are you compensating to even do that action? So looking to see kind of where your body is, or do you start to come into your shoulders to be able to do that? So, you know, like doing that exercise and then catching yourself with any sort of compensatory strategies as well.
Absolutely. And then I have one last thing I wanted you to address. Love to hear your take on this. So I've heard over the years kind of controversial things about perineal massage.
Mm.
You could explain a little bit about what that is, and what the like kind of the benefit, the thought process behind it is, and whether or not you recommend it.
Okay. So for perineal massage, the idea is to be able to prepare the tissue for the baby to come out. Okay. So we've got the vaginal opening and we've got the muscles and tissue all through here. So there are some protocols out there that can be a little aggressive for my liking, where they actually have you put both thumbs in and kind of stretch a lot outwards and really, and basically they're trying to prepare that tissue to be able to stretch. There's no evidence-based research that supports the fact that that's going to help you to reduce, the idea is to reduce tearing. So you're kind of, you're making the tissue more malleable, more pliable, more stretchy, to prepare for delivery. But there's nothing really out there to support that helps or that can reduce tearing. I think it can't hurt to do some massage to increase circulation and just to prepare the tissues and to prepare yourself. I think it could be a good connecting experience, but I'm not sure that like stretching to the point of pain is necessarily going to help you. A lot of times our tissues respond to pain by tensing up. So I almost think that you might be just, I mean, they're going to go back. It's not like you're going to stretch it and they're going to stay loose. It's not really how they respond. So I say if you want to try to do some nice massage a couple weeks before delivery, I think that's a fine practice. But I mean, I guess I'm just not really big on putting people through pain. And the body prepares itself and will respond. I think hydration is probably a better defense against tearing. And they say that your body needs to be hydrated a day before the episode, the delivery, for it to actually be hydrated. So like, you know, getting an IV during delivery, one, like some people have said that it could even slow down delivery process because it's filling your bladder, just making your bladder full. So it can actually kind of interfere and impede the delivery process. But it's actually not going to hydrate your tissues immediately. It takes that 24 hours to be able to actually make the tissues hydrated, so they're not going to tear. So I say just be super hydrated all the time during pregnancy, in case you never know.
Yeah, great. And it's easy too. Just drink water, nice and easy.
You're gonna be peeing anyway, so
It'll be nice and clear, right?
Yeah.
Now, Laura, were there any other questions that we didn't talk about?
I think so I had pulled up a picture just because I love this picture. I think there's a round ligament question that you had from earlier in the week, and let me just pull it up. Okay. Oh, that's not it. Oh, I had it all set up here. Oh, it may have gone. Oh, I got it. Okay. So your round ligament.
Yes.
I'm going to pull this closer. Let's see. Get this out of the way.
Yep. Perfect.
My new ring lights. Okay. So if you look here, we've got the pregnant belly in the front. This person's standing sideways, and the bum is right here, and that's the spine. So here's the uterus and the baby, and then this line is the round ligament coming from the uterus down towards the pubic bone. Okay, so this is the bladder down here. So you can see how far that thing gets stretched, and then this here is your uterosacral ligament. So from the uterus going back to the sacrum. I just love how this picture just points out those ligamental attachments, and like the accommodation that the body makes for that. So
crazy.
Yeah. So I mean, you know, round ligament pain. Oh, right? Okay. Round ligament pain. I mean, you're putting a lot of tension on it. So, just kind of being able to accommodate for that and strengthen and
Yep.
support tissues upwards. So
Yeah. So round ligament pain, I think from a lot of my clients' comments are usually somewhere around like when you really start to stretch between like usually like 25 and 28 weeks, like when you really start to show. I've definitely had people, complain about that around that time. It was actually really funny. I have two clients who are like 2 weeks ahead of me, and we all the same day we all came in and we're like, oh, round ligament, so painful today. And it's just like as you start to stretch, it makes total sense. And you look at that image. I've never seen an image like that of how far it has to stretch. So what can women do aside from? Do you think that a belly band is also helpful for round ligament pain?
yeah, it can be. Sometimes some like fascial release techniques can help relieve pain. Positions.
Yep.
All kind of pressure management.
Yeah.
Kind of work through all those things.
Yeah, like I know that so my chiropractor who practices Webster technique, she does some soft tissue work, some fascial work while she's treating. And so that can be that for me that was super helpful when I was having that round ligament pain, just for her to kind of like work on that position. Like it was like right under my belly, like right in front of my hip bones. That's where like the pain was the worst. And it's kind of alarming because it can get a little bit of a sharp pain and you're like, oh my gosh, what's wrong? As long as there's something and you've never had it before, you have no idea what it feels like. And then you're near your doctor or, your provider goes, oh, it's just round ligament pain. You're fine. And you're like, but I want to do something about it.
Yeah. Get rid of that thing.
Exactly. Fix it. So to have like a chiropractor who does practice Webster technique can be really helpful, or to go see a PT and OT.
Yep.
Or even a prenatal massage for someone who really knows what they're doing can be really helpful too.
Absolutely.
Yeah. Yeah, I love that. I think I'm trying to think of all the what about SI pain?
Mm-hmm. So SI pretty similar to the pubic symphysis pain. Mm-hmm. So it's basically, so we get dysfunction, misalignment, extra pressure here. Same thing with SI joint pain. So sometimes, SI joint pain, non-pregnancy related, could be you want to kind of figure out if it doesn't have enough closure, if it doesn't have enough compression and it's not finding its place, or if it's too much compression. Pregnancy will probably have too much compression. Mm-hmm. So just making sure that any one-legged things we want to try to avoid. So because we can get shearing or pressure here. Starting to think about, doing if you're doing single leg squats with the TRX bands, bring it down to 2 legs or, anything that you can do bilateral, like both sides.
Yeah. Even like lunges. I feel like deep hinges. So like deadlifts can also be very triggering for the SI lower back pain and also the pubic bone pain because of the way that it loads the pelvis.
Yep. Yeah. Especially if you're not super careful of doing that hip hinge, if you start to get a little bit of, if you're getting a really good hip hinge and this is where the movement's coming from and this is all staying stable, right, then you're good. But if you start to get into a little bit of a pelvic tuck and you're starting to change the relationship here, right, then that's when you can start to get some strain. Yeah. And it's hard. You have to be strong, and you have to actually be able to be flexible and strong to be able to lengthen here, right, to be able to hinge and keep this. Because I'm a big pelvic tucker, so I like to create stability by tucking under. Right. Okay, so as soon as I tuck under, I'm flattening this curve. I'm putting tension on the SI joint and the lumbar spine. So getting out of that habit, keeping a neutral pelvis, and bending here. So you got to lengthen
Right.
at the hamstrings and the glutes and get those to be able to come online. And you'll get a much nicer butt. Because if you're always tucking your pelvis, you're never
Right.
really using your good glutes. So,
Right.
um,
So it's
yeah.
like that thing.
Yeah. And being able to, like being able to kind of learn these things before pregnancy, like having a really great strong baseline and awareness of what's going on in your body before is ideal. We don't always get there. Being able to address things that come up during pregnancy, not waiting till postnatal,
Yeah.
is fine too if you weren't able to kind of get started before pregnancy.
Mm-hmm.
But even if you don't count yourself out. Jump in with retraining and connecting with your body, as soon as you can postnatal, or even if it's been like 10 years. If you're 10 years postnatal and you're just getting this information, it's still going to be helpful. So
Absolutely. Yeah, I love that. Yeah, that's great advice. Awesome. Well,
cool.
had so much information there. I'm excited to like post this and have this as information that people can access, because we will be posting this after our live feed. And then next week, we'll be talking about postnatal. So after birth, pelvic floor, all the pelvic floor things, probably won't be able to address all of them, but a lot of them, which is like such amazing information. I'm really excited to talk about that next week.
Yeah, definitely send your questions. We got from the last one, I at least got a lot of feedback about wanting some breathing lessons. So we'll add that into the mix to get specific about breathing strategies and exercises, and we've got a whole bunch of other topics too. So
Yeah, so excited. Yeah, send us your questions and any topics that you want kind of discussed in general or anything like that, and we'll do our best to get to them next week.
Awesome. Thanks, Nora.
All right, thanks, Laura. Have a good night.
You too.
Bye.
Bye, guys.